Audio Jungle.
So this meeting, by imparting skills to the different players at the different health facilities and the community, will contribute in reducing maternal mortality and child mortality, and in so doing, improve the chances of Ghana attaining the Sustainable Development Goal, and specifically attaining the Sustainable Development Goal number 3, which aims to improve universal health coverage. It's always worrying when there are stockouts, but fortunately, the Ghana Health Service and government were up to the task, and as you saw, the vaccines came in. I must also add that Ghana has performed exceedingly well in the area of immunization, and that the short stockouts do not normally affect the long-term picture in terms of the performance in terms of immunization coverage. For the last decade, Ghana has sustained the immunization coverage well over 95%. So the short-term shortages will not affect that. But if they are sustained in terms of the period, then we get worried. But for now, I think we are getting back to normal, and hopefully this was a one-off experience. What we can say is, and I know that they're always working on keeping a tab on what is happening. I think what is important is just for us all to, from the facility levels, to be up to date with what we have in stock and report it in a timely manner so that action is taken as soon as possible. But it's something that we are aware the health system is trying to develop, and that is ensuring timely reporting of the stock levels from all levels of the health system, so that when they reach a critical level, we then move ahead and, as a country, order new stock. This is an ongoing program. The 10 countries were the first countries that joined this network. Obviously, as WHO and working with other partners, our hope is that we will be able to encourage other countries across the African continent to join in this network of care. And the whole idea is the countries that came up took a bold decision to say they wanted to do something about the maternal mortality as well as child mortality. So they were the first opters of joining this network, but certainly going forward, more countries will join this network, and that is why this meeting is very important in reviewing some of the key actions that need to be put in place when we start expanding such a network, such a program across the country. The meeting basically has set indicators, and we know that amongst the different contributors of mortality of children and mothers is the quality of care they receive at the health facility. So, for example, do they have a qualified maternal practitioner, or what we call midwives, who is attending to the pregnancy of the child, of the lady? Do we have trained health workers who are looking out for the newborn child from birth up to the time that they grow up? So these are areas that we try to improve. And of course, the distribution of health workers. Where should we be distributing the health workers? In this discussion, we think the great emphasis should be really distribution of qualified health workers as near to the community as possible, so that we reduce the travel time from your house to the health facility to seek medical attention. There are also issues around commodities that help during pregnancy and during delivery. Availability of those quality commodities is essential. And so you will see during the discussion in these programs that they're talking about what are the key minimum package of care that should be there for us to deliver quality services. So it is really an opportune time for us to learn from all the other countries, because they all started at the same time. There is a difference in the progress that has been made, but all of them has made some progress. And then Ghana, for example, has made a lot of progress in reducing institutional maternal mortality as well as deaths in the newborn. So those are the examples that we want to share and bring out how they did it, so that we all learn from those and move forward with the other
The
actions.
quality approaches needs strengthening for significant impact on patient experience and health outcomes. Distinguished ladies and gentlemen, let me say that the past 2 to 3 decades has seen considerable efforts and investments in promoting maternal and newborn health in Ghana. This has resulted in increased coverage in maternal and newborn health indicators. ANC by skilled provider increased from 96% to 98%. Births occurring in the health facility increased from 54% to 79%. And births attended to by a skilled provider increased from 55% to 79%. Neonatal and infant mortality reduced from 29 to 25 and 50 to 37 per 1,000 live births, respectively. Despite this progress, Ghana's maternal mortality of 319 per 100,000 live births raises red flags for mothers and babies receiving care. Most of these deaths are preventable, and about 65% of them attributable to 4 causes: postpartum hemorrhage, hypertensive disorders, abortion, and sepsis. Despite considerable investment in healthcare, there is still a lot more to be done to further reduce maternal and neonatal mortality. The current number of such deaths could be more than halved by accelerated investments in providing access to essential reproductive health services, such as family planning, skilled attendance at childbirth, administration of oxytocin for management of postpartum hemorrhage, and use of magnesium sulfate for treatment of pregnancy-induced hypertensive disorders. Universal access to emergency obstetric and neonatal care could reduce maternal mortality by 90% to 38 per 100,000 live births. Distinguished ladies and gentlemen, as a network, let us continue to complement our existing national health quality strategies and ensure that every pregnant woman and newborn receives the highest standard of care throughout pregnancy, childbirth, and the postnatal period. This network provides a platform for peer review among the countries in the network. It is my hope that we can extend this peer review mechanism within the intra and inter-sub-regional, regional, and global space to give meaning to the network to remain formidable in its approaches and what it stands for. And I'm very happy myself this morning to see several countries from Africa in this event: Malawi, Uganda, Kenya, Nigeria, Cote d'Ivoire, everywhere. And I think this is a good plus for the network. To the partners who have committed to improve quality of care, we are grateful. And it is my hope that we will continue to support the priorities of countries gathered here towards improving the quality of care provided to mothers, newborns, and children. Indeed, effective partnerships, collaboration, and solidarity is now needed more than ever. As we take stock of progress in the coming days, I urge you to reflect on the feasibility of opening up the network to other non-participating countries to all benefit from the technical assistance, financial support, and cross-learning collaborations that the network offers. A woman dying in any part of the world counts. Again, I know that the focus of this network was to reduce the maternal deaths in implementing facilities by health, and even as a continuous thing that we must keep aiming at. Distinguished ladies and gentlemen, I think at this stage I will take a singular honor, even as I welcome you to Ghana, to declare this 5th global meeting officially opened. To deliver essential quality healthcare to every woman, every child, every family, everyone, everywhere.
Thank you for watching Nation One TV. Kindly subscribe for more news updates.